Thanks, Theo. So as Theo said, I'm Melissa, and I'm pretty excited to share my story with you guys today. Hope everyone can see my screen. And basically, I'll be sharing how I went from being a medical doctor in South Africa to now working as a UX designer here in Amsterdam. And the 1st of May actually marks my 1-year anniversary in UX healthcare, working at the health tech company My Tomorrows, whose mission is really to help empower physicians and patients to access developmental treatments. And I would say it has not been an easy journey so far because I'm operating in a UX team of 2. My official title is web designer, but I've really had to perform many different tasks and wear many different hats to really flourish in this role and adapt to what the company's needs are. Looking back at this first year, I think I can really see quite a lot of highlights. And the first being the first design sprint I did at My Tomorrows in my 3rd month working there. And I think another point would be around seeing and promoting user research really being incorporated into the product development cycles more. And I think it's really been great to see the UX culture within the company really start growing alongside my own UX skill set. But enough about my current role. We wanted to look into how did I actually go from being a medical doctor to now working in UX healthcare. And I think to understand this, we need to start with the why. And I've spent, I think, quite a lot of time now really reflecting on why this is. And I really wanted to highlight kind of 3 main themes with you guys as to why I decided to leave clinical medicine. The first, I think, was that I really just didn't feel like I had a creative outlet anymore. And as you can see from these photos, I think my whole life I've always loved being creative. Whether it was doing arts and crafts, singing, dancing, or acting, cooking, baking, I just love being creative. But in the hospital setting, it doesn't leave that much room for creativity besides being creative when it comes to using the limited resources available to you. And apart from that, I would organize the baby showers and birthday parties and set them up in the staff tea rooms and also bake cakes and cupcakes for parties that we threw in the pediatric wards. So you can see that's a picture of me on the right, handing out one of my homemade cupcakes. But I think the longer I stayed in medicine, the less I wanted to partake in these activities and the less I started feeling like myself without having the creative outlets I think I needed. And so I was already starting to think, I need to do something different. But I think the biggest reason for me for changing was really around that what I thought it was going to be a doctor was completely opposite to the reality. There was definitely a mismatch between my expectations and the reality of being a doctor. I think I signed up for medical school when I was 16, going on 17. When I applied to get in, I knew I definitely wanted to help people. And I think my idea of what a doctor was based on the many consultations and interactions I had had with our family practitioner. No, that's not her. Yeah, just to give you an example. And I think medical school, the 6 years there, does try to prepare you for the realities you will face working in the system. I remember in our first year and our second year, we did a becoming a professional course and becoming a health professional course. And here they started teaching about the difference between sympathy and empathy, counseling, skills, interview skills, as well as self-reflective practices. I remember we had to do a project where we had to keep a journal, but these usually aren't taken that seriously, and I don't think one realizes the valuable role it could play later on when you start working. And so when I graduated and started working and doing the 2-year internship, which is basically after you graduate, you have to do a compulsory rotation through major disciplines to equip you with the necessary skills to be able to work in these independently without supervision, and really get really hands-on practical experience in the different fields. And I think working for internship, I really didn't feel like I was prepared, or rather, not so much that I wasn't prepared, but more I think that I wasn't supported in the system. And I think that on top of all the different pain points I can cover for you really just made me not want to continue on in medicine. So just some of the pain points I think you can see are looking really tired in the second picture. I used to really struggle to sleep after we worked the 30-hour shifts. You'd think I'd fall straight asleep, but because your sleep pattern is so disrupted, I used to really struggle to actually fall asleep. Some days I'd work, I think the 30-hour shifts that you'd have to work was usually at least twice a week, and sometimes even 3 times a week. And I think you just become so physically and emotionally exhausted. I'd say emotionally exhausted because of the types of cases you deal with in the overburdened system. You'll see patients pass away, patients that you've treated, or a different team's patient. You'll have to counsel the families. I've delivered babies to teenage moms, and they've had to undergo cesarean sections. I've I clearly will always remember delivering these premature twins in that admission room to a drug addict mom who then, once the babies were delivered, decided to abscond. And I think working also in the healthcare system, you're also exposed to various occupational hazards. I luckily in my internship didn't get a needle stick injury, but in my following clinical years I did, and had to go on prophylactic antiretrovirals to prevent or lessen my chance of contracting HIV and other. You also have to screen for other bloodborne infections. Yeah, I think I can continue on and on and on, but I think you can get an idea of the types of challenges that one faces working in the healthcare system. That's what I really wanted to highlight. And so I made it through internship, and I also made it through the 6 years of medical school. So I didn't want that all to be for nothing. And so I thought, okay, I need to try and make it work. That clearly has to be the worst of it. It's going to get better from here. And so what I did from there was try to work in different specialty areas. So I worked in anesthetics and in family practice. I really enjoyed anesthetics, but I think when I ended up even doing my diploma and was seriously considering specializing in anesthetics. But for me, I was in my second year of working in theatre. I was in a government hospital, and we became seriously understaffed. And I was being expected to do quite major cases with no kind of real senior supervision. Well, I had supervision, but it was on the telephone for the most part. And I think it would have been nice to have a senior there in the room, just to assist with kind of the more serious cases. I think the one that stands out to me was when a stab heart patient comes to theatre. They basically resusc in casualty, rushed up to theatre, and you have to just go for it. And the one case I did survived, so that was always a good feeling. But yeah, it's very, very stressful, and especially when you don't have that senior supervision for those types of cases. And then I also switched from government sector to the private sector in the hopes that I could work less hours, and also I would hopefully have more resources. But in the private practice I worked, because it was a family practitioner practice, we catered and tried to serve the middle to lower income communities. And so you were also restricted in terms of what medication you could prescribe that they could afford. Yeah, I think it just came with its own new challenges and limitations. And so also, I think the good thing that I did was really stop switching from the theatre to private practice and working in the general practitioner office was really around that I didn't have the long work hours anymore and no more night shifts. I did work in the evenings, but I mean, that session was usually, I think, what time? I think 7 till 9, 5 till 9, 10. When it was really busy, then you'd finish at 11. But I was in bed by midnight, so I was more than happy to do that. And I think having this kind of work-life balance restored really gave me a lot of time to reflect on what I'd gone through and what I'd been feeling about my profession. And for me, I really, having that extra time also then kind of unearthed a lot of buried emotions. And that combined with other stresses in my personal life actually led to me requiring professional help. And I actually went for 3 months of psychology sessions, and I spent 6 months on low doses of anti-anxiety medication just to help me through that patch. And it wasn't long after this that I would actually end up leaving clinical practice. And I think the biggest reason being was that with regards to this expectation versus reality was that in the system of low resources and time constraints, I really wasn't going to be able to be the holistic doctor that I really wanted to be for my patients. And I found that really frustrating. And I think the emotional and the physical toll the job had taken on me and was still taking on me just couldn't be ignored anymore. And the third element, I think, that really kind of sealed the nail in the coffin of my decision to walk away was really what was a change in my mindset. And I think if I look back, this happened kind of in 2015. And these are my parents, and in the space of a year, my mom was diagnosed with a life-threatening disease. And my dad was also diagnosed with a chronic, progressively debilitating condition. And they're both okay, doing well, but you can definitely see that these illnesses have impacted on their lives. And I think it's had a profound effect on my own outlook to life, because I think it highlighted for me that really you're not promised the same abilities that you have today. And for me, you're not promised the same abilities, and I think in one day, kind of everything can really change. I mean, even just this year, I had two really good friends that were traveling with their two kids, ended up in a car accident, and both of them are deceased now. So I think this kind of thing kept coming back to me of, am I living the life that I want to live? And am I happy? And I think even with all these feelings, I still felt trapped with the financial stability that medicine offers, and not the unknown, facing the unknown of what else is out there for me. And so the final kind of pushes I needed, the first one actually came from my ex, or the push I needed actually came from my ex-husband. I think it was super refreshing to see somebody so passionate about their job, especially for somebody whose own passion had just burnt out. I think I was definitely jealous that he worked less hours and still kind of enjoyed financial security, earning, I think, almost the same as me, just maybe slightly less. He would receive job offers from all over the world, and I really liked that he had this ability to be able to just hop on a plane and go work anywhere in the world, which is not the case in medicine, and I'll come to that in a bit. And it was just interesting to see in these employment packages he was offered, they would pay for the relocation costs, they would pay for travel allowance, accommodation allowances, and even paid for me to relocate with him. So I just felt like his job really appreciated him and supported him by paying for online courses and tuition, as well as would make sure they had social outings and team building excursions monthly. And so I really felt like, what was I doing in a system that really just expected you to, obviously it is your job, but it would be nice just to feel appreciated for the effort you're putting in. And so when he was given the opportunity to come work in the Netherlands, I said, let's go, let's do it. And so we got married and moved here to the Netherlands. And then it was, okay, so do I try and register here to practice, or do I just go pursue something new? And I think anybody that's done this move, if you're an expat in the medical profession, you need to become registered in the new countries, with the new country's medical council. And what that means here in the Netherlands is I would need to become fluent in Dutch. And once I passed the language exams, I would have to then pass the clinical and theory exams. And after this, I would have to do a training period that they would define based on the outcome of my results if I passed. And then after I've done this, then I can start looking for a job. And so it can be quite a lengthy and expensive process. And for something that I just wasn't that really invested in anymore, I really decided it was time to start looking at other options. And so we finally reached the how did I actually go about changing careers then. So most of you might be familiar with the double diamond design model. For those that aren't, it's a framework that divides the design process into kind of 4 phases. And I thought it was quite fitting for my process of how I went from doctor to designer. So we start with the problem around, I was really unhappy working as a doctor, and it wasn't, and those pain points that I experienced far outweighed the positives of helping patients. And I spent a lot of time reflecting on what all the pain points were, and I've discussed all the issues that I identified around why I was so unhappy. From here, I could define a wish list of what did my new job need to have. So number one was obviously it needed to be something creative. It included working kind of a 9-to-5 job with very minimal overtime, financial stability or security rather, and that was kind of, I think, my top 3 on the wish list for what I wanted. And now I had kind of an idea of what I wanted. Now it was time to start thinking about what jobs were available that kind of matched this wish list. But it was around about this point that I was like, oh wait, I'm leaving medicine. And I started having kind of an identity crisis, because for so long you only ever introduced as Dr. Melissa Theunissen. And it's easy when your job really does take over your life for it to define who you are. But if you no longer have that and you're no longer a practicing doctor, then you start thinking like, well, then who am I? And still, while pondering this, I decided to just keep going, keep pushing forward with this kind of weighing on me. And I started doing Google searches and looking on Facebook support groups to try and find what the hell is out there for me, and is any one of those options ticking off the boxes on my wish list. And I really was having a hard time, and I really wasn't finding a good fit for me. And so my ex-husband took me to, he's a software engineer, and so he said, right, I'm taking you to a coding developer boot camp, open day, and you're going to check it out and see if that's something you want to do. And so off I went to the open day with him, and I was actually surprised to find that they offered a design course, and I was super interested in what this gentleman was explaining to me. It's like, this sounds, like it ticks off the boxes on my checklist, and it sounds interesting. And so when we got home, I jumped straight onto YouTube and was typing in design thinking and what is UX, and watching some videos and really getting excited around, okay, I can see myself in these people. I can identify with what they're doing, and the topics they're discussing are really, really interesting. I think this is something I want to pursue. And so I applied for the bootcamp. You had to do an assignment and an interview, and I got in. And I did the 12-week kind of very intensive crash course where you live and breathe design, doing lots of hands-on practical, go out and start interviewing people, run a design sprint with companies that they had given us kind of mini projects. So that was super fun. But I don't think it would have been possible to have gone through this journey without an amazing support structure behind me. And I think for me, that was my family and friends, who initially was like, what are you doing? And then when they saw how happy I was and excited I was to be in this field and trying this out, they really got behind me and supported me. But most of the support was actually virtual, because I was new in the Netherlands and they were all in South Africa or in other parts of the world. And so I needed to build up my own local support structure. And as you can see, this is my 2 cats, and they would keep me company into the night when I would be working on case studies and assignments. And as well as I also obviously developed quite a close relationship with quite a few of my colleagues in the design bootcamp, and we formed our own little support group to help each other through the process. And even after the bootcamp, I'm still in touch with some of them today. I then also reached out to the UX communities in Amsterdam and Utrecht, and would try and be quite active in the meetups, asking questions, networking, and would also volunteer at the bigger events. As you can see on the left, that was an event in Utrecht done by the Ladies That UX Utrecht group, or it was actually a joint venture between the Amsterdam and Utrecht meetups, and also volunteered at the UX camp meetup. So I mean, there's quite a lot of different ones to get a good feel of what it is and continue growing your knowledge and in the field, and also start connecting with other people in the community. And I also gave a talk it was entitled Redesigning a Life You Love, and it was really around sharing experiences around burnout and how to apply kind of design thinking to help prevent or deal with burnout. So that was quite an interesting discussion that we had. And so at the end of this, I got my certificate, and I think it took me about three months before I landed an internship for a month at a communication platform in Amsterdam called Plek. And then I got the call to say, I think in my first week at working at Plek, I got the call to say I landed my job at Mike Tomorrow's, and have obviously been working there now since last year, May. And I think what I've realized looking back is that I didn't find a solution to the problem so much as I really feel like I evolved personally, and that I'm not so much just a designer or a doctor. I feel like I'm both and more than just my profession. And I think I'm really happy working in the UX healthcare space. And my advice, I think, to anybody else considering changing careers would be really have faith in yourself. You have to be brave and courageous and trust that the efforts you're putting in and the determination you have will be enough. And hopefully with a little luck and a little pixie dust, you'll make a successful career transition into UX. And that was the story I wanted to share with everybody.
Love the journey. There's one question that just popped up there. I'm just going to read the question here. It's from me, really. In the medical profession, is the patient experience or journey something that's discussed as a physician?
I don't think so. I think it depends where you're working. Not so much, I think, in the public sector. I think in the private sector where it's your business, I think there is some discussion that happens around it. But I don't think there's much discussion and consideration of it. I think we all are aware of what the patient's experience is. And there are people trying to change that or make a difference. But I think it's tough because you exist in this bigger context, and all those bigger contextual things need to change in order for the patient journey to really be improved. If that answers your question, Theo.
Yeah, I see as another question from Lizette.
Mm-hmm.
And she's asking, what specific part of your previous job in healthcare helped you the most now as a UX designer?
All right, so I actually had some slides on this. I didn't know if I had time. But basically, I think you develop quite a lot of empathy. Your empathy skills really grow when you work as a doctor, because you need to understand very quickly what does the patient actually need, And so that transforms really nicely into UX, especially when you're doing user research, and when you need to sort of draw from that, I think, the insights of what is the underlying need that needs to be addressed. Other things would be like, we are used to also advocating for our patients, and I think as a designer, you also need to advocate for accessibility to your healthcare service or platform. Whereas when you're a doctor, you're just advocating for them to have access to healthcare itself. So it's just kind of a niche, kind of almost within that. That's how I see it. You also, your job is literally interviewing and listening to people. And as well as your job is also to be a problem solver, because patients come with a list of varying symptoms, and you have to, from that, and with the help of obviously some examination and further investigations, come up with a definitive diagnosis. So yeah, I could go on. There's quite a lot of different skills I think I utilize from the healthcare space in the UX space now. But I hope that gives a few examples.
Okay, yeah, thank you for that. That question was from Sarah.
Yeah.
So the next one is, this is actually from Lizette. So
Yeah.
are there any parts of being a doctor that you miss?
Definitely the people. I think I've met quite a lot of amazing people along the way. Yeah, I definitely miss that. You obviously do miss that, the thrill of after a recess, the patient makes it, and you're like, I did that. I really helped make a difference for that patient. So you do miss, to an extent, I think, that like instant gratification of, I do this thing and the patient's better. Whereas in UX healthcare, I kind of, I'm building this platform or this service, and I'm not going to see for a while before what difference it makes in their lives. Yeah, it might be more of an indirect and a direct effect on their life. Yeah.
Okay, great stuff. Thank you. And here's another one that we have. How can you explain to doctors that it is value in UX and motivate them to accept changes in the way they practice and the tools they use?
So for me, I've also been thinking about this because I've had to explain to my own friends that are doctors what is UX, and I think it's highlighting what things you're already doing, kind of, and that kind of fits in the design thinking kind of process, and how you can start looking at the service that you're delivering from a design perspective, to help address some of the issues that you kind of, or they already know but haven't really documented anywhere around what are those pain points within the patient's journey and interaction with the service. Let me just read the question again, but I think that also answers it for the most part. Yeah, I think it's just generating general awareness around what is design, because I had never even heard of that till I got to Amsterdam. So I think it's building, this is what it is and this is how it can help. I think just creating that kind of general awareness will already start helping. And there are, I think, some physicians that have even reached out to me around that are already thinking about incorporating or thinking about health tech, especially I think it's the doctors that are involved in these health tech platforms that are really thinking about how can they help improve the patient's experience. And they're the people that are interacting with the patients. So they're also kind of at the front line of hearing what are the different complaints sometimes that patients have.
Okay, great stuff. And we have one more question here from Jen.
Mm-hmm.
Jen G. You indicated that there were barriers that needed to be fixed before the patient journey could be fixed. Could you give a few examples, please?
So the contextual barriers. So these are kind of more the social problems, I think, that indirectly affect. So like the political climate, there's been quite a lot of corruption. I'm not sure if you're aware of the South African political scene. But that all has an impact on then how much budget is allocated to healthcare. Is that budget that's allocated going to the healthcare sector? I mean, there was quite a few scandals around one hospital in KZN, the kind of people at the top were pocketing money, and the facilities weren't being upgraded. They're also wanting to launch the national health insurance in South Africa. And so there has been a lot of primary healthcare facilities built, but there isn't really that much staff. So there's you working in an overburdened system with less doctors and other healthcare professionals able to manage the amount of patients that need assistance. And also in South Africa, you've got the private and the public sector. So I think that was also what introducing a national health insurance was trying to address, where there's less patients kind of almost for more. The doctor to patient ratio, I think, is lower compared to the public sector, where, yeah, you see at least, I think, 30 patients plus in a shift in the public sector. And I think I think there's just quite a lot of, I think you have to think about all the different social issues that could possibly impact, because I think even like before our patients even reach us, I mean, especially for a large majority of our population is in the lower income bracket, and just for them to even reach the healthcare facility is a challenge. And so that forms the beginning of their patient journey, even to get access to the healthcare. And so there's so many, just by improving the public transport system, that could help improve the patient journey. So it's looking outside of just directly in the healthcare space, how it could be improved in order to impact on the patient journey. So I don't know if that answers your question, Jen.
There's just one more question from Leanne that just popped up here. I don't know if you can see the question there.
What would have been some highlights in your experience that would have lessened the physician emergency health room painful experiences? I think it's, because again, this is also, electronic health record. So we didn't have a electronic health record in South Africa. Everything's on paper. So having one would be great. Health record. I know in the private sector in South Africa, they started using it. And I've seen them use it quite happily here in the Netherlands. I think my interaction with was looking up blood results and then filling those in the patient's file. So I think for me, I don't really have experience using electronic health records. I've only ever used the paper-based version. So yeah, I can't really comment too much there around that. But I think as if you're involving the physician in what do they need to do at different points in care, I think that would help really address, make sure that you're meeting their needs at the different points of care, whether in the emergency room versus in the ward. You have different time that you can dedicate to the documentation, I think. Let's see. So that's that. And then, if there were no constraints, what would be a game-changing or industry-changing innovation in healthcare? Goodness gracious. I don't know. I don't think there's a perfect answer for this one. I don't think I've allowed myself the time to really think of this. But for me, I think what I would want to see happen is that patients are actually receiving holistic care, because a lot of the time we're forced to look at them, just solve the problem they're coming with now, and not look at them within their bigger social picture, and understanding them within their family, within their community, and then within the country at large, and looking at those kind of all those different levels around how do we help those patients, because I think that's where you'll really start to see a change in the healthcare status of communities. So I don't know if that helps, but yeah. That was a tough question, Paul.
Thank you, Paul. Thank you for asking that. Okay. So what we're going to do, thank you very much, Melissa. Appreciate that.
No problem.